Hello.
Hi, my name is Brittany, and I was recently diagnosed with major depressive disorder. While I have the support of my family, I'm still feeling sad and overwhelmed. I'm having trouble understanding and getting control over my diagnosis.
Well, hello, Brittany. My name is Stephanie.
My name is Asia.
My name is Amaya.
My name is Ashley.
My name is Jasmine.
My name is Tia, and we would be more than happy to provide you with some information and hopefully make you feel more comfortable by the end of this teaching session.
Okay, I'm just going to start by defining what major depressive disorder is. So, major depressive disorder is characterized as persistent episodes of depressive moods or loss of interest in activities, causing significant impairment in daily life. With time, episodes tend to occur more frequently, become more severe, and are of a longer duration.
Risk for developing depression or major depressive disorder. So some factors include being a female, having a prior episode of depression, lack of social support, lack of coping abilities, life or environmental stressors. So, COVID, that could place you at risk, and current use of substances as well.
So for the signs and symptoms of major depressive disorder, you would experience the following symptoms persistently over a 2 week or more period. The symptoms that may be experienced are having a depressed mood, so feeling sad, hopeless, or empty, adononia, which is an overall feeling of lack of pleasure from activities that you used to find enjoyable. You might see significant weight loss even when you're not dieting. You may experience insomnia, which is where you have difficulty falling or staying asleep. You might experience hypersomnia, which is excessive sleepiness or drowsiness. You may also experience psychomotor agitation, which is basically when you have an anxious restlessness that may occur and you might make movements that you don't mean to. You may experience fatigue, feelings of worthlessness nearly every day, diminished ability to concentrate. You might have some indecisiveness about daily activities, and you may have recurrent thoughts of death or suicide.
So for treatments, one of the treatments that we have is medications, so antidepressants. So we have SSRIs like sertraline and paroxetine, and side effects do include weight gain and sexual side effects like sexual dysfunction. We also have SNRIs like duloxetine, and it can cause anticholinergic effects. So if you have a dry mouth, you would like to, drink some fluid, chew gum, dry eyes, eye drops and stuff like that. We also have MAOIs with like phenelazine and selegiline. But with MAOIs, you don't want to use it with other antidepressants. You want to use just the MAOIs by itself. So what something you have to also look for is it does cause a tyramine toxicity. So you don't want to have like wine, cheese, chocolates, sausages, all of that stuff in your when you're taking MAOIs. And we also have atypical antidepressants like trazodone. So you want to also take it at night because it causes hypotension.
Along with medication treatment, we can also do psychotherapy. And this is basically just doing therapy sessions. And this is going to help the person identify and work through factors that may be triggering your depression. You can also understand the behaviors, emotions, and ideas that contribute to your depressed state. This can also help you regain a sense of control over your life. So like when you're feeling like you don't have energy to do anything, we can like figure out how to work you through that, learning how to cope, and also developing problem solving skills. So how to get yourself out of these situations that you're feeling.
And so now we have a video to show you in regards to depression. So hopefully this video is going to tie everything that we just discussed together.
So I'm going to share my screen so you can see.
now, Brittany, do you have any questions in regards to the information that we have provided to you?
Yes, actually, I had a question about medication. So you mentioned SSRI. What medication you were saying specifically? Like an example of it.
So for SSRIs, we have sertraline and fluoxetine or paroxetine.
Thank you.
Major depressive disorder, or MDD, is a common but serious mood disorder that impacts the way a person thinks, feels, and behaves. It can have an impact on daily activities like eating, sleeping, and working. To be diagnosed with MDD, symptoms must be present nearly every day for at least 2 weeks. Some of the symptoms can affect your behavior. This video will focus on behavioral symptoms of MDD and how a professional may be able to help you.
My doctor diagnosed me with MDD. I was really worried, but he explained to me that MDD is common and treatable. It usually includes a combination of therapy and medication.
When a person is experiencing MDD, some behavioral symptoms can include decreased energy or fatigue, moving or talking slowly, and trouble sitting still. You could also have difficulty sleeping, like early morning awakening or oversleeping, and changes in eating habits. People with MDD do not always experience the same symptoms.
In addition to my medicine and therapy, my therapist gave me some great practical tips to help me with my MDD. Keep regular appointments with a doctor or other mental health professionals. MDD is treatable, and they can help you determine the best course of treatment. Try not to isolate yourself. Spend time with others and confide in someone you trust. Be active. Exercise can boost your mood and sleep quality. I started scheduling fun activities with my friends ahead of time so they can help me stay active. I found this helped with my depression. Ask your doctor or therapist where you can find information to educate yourself about depression. Keep a record of the tips you find that seem to help. Be patient. The symptoms of MDD may improve gradually, not immediately, as you take these steps toward your treatment journey.
Trisha, you nailed that presentation today. Are you feeling better?
Thanks, I am. I've been working hard at it, and it's paying off. I'm feeling better every day. Come on, let's go to lunch. My treat.
Okay, so hopefully that video just provided you with, I guess, imagery and understanding of the signs and symptoms that are associated with your disorder. So now we have what is known as like a picmonic. It's going to just reiterate some of the information as well.
Depression assessment by the depressed emo being studied in the jail cell, man wondering how he got there. It all began when the depressed emo's no energy bunny died from a lack of energy, signifying the physical change of anergia experienced by depressed patients. The emo blamed himself and fell into a state of self-neglect, shown by his neglected appearance. This led to decreased libido, the down arrow libido limbo contest, causing him to lose at the game with his girlfriend, and vegetative signs shown by the vegetables with vegetative signs, signifying changes in a patient's normal eating, elimination, or sleeping patterns. Several moods may manifest, including a sad affect, shown by the sad face on the emo, worthlessness, the emo's empty pockets, guilt, shown by the guilty gavel, and anger and irritability, the angry and irritated judge sentencing the emo to jail. Cognitive attributes may involve ineffective problem solving, shown by the emo unable to solve the problem cube, and slowed thinking, the mind gears all gummed up and slowed down. In summary, depression assessment may include the physical changes of anergia, self-neglect, decreased libido, and vegetative signs. The patient may experience various moods ranging from a sad affect, worthlessness, guilt, anger, and irritability. Cognitive issues involve ineffective problem solving and slowed thinking.
Okay, so now we have a quiz that it's going to show. So let's.
The assessed man was making.
Okay, so it's a 10-question quiz. The first one says, which of the following clinical findings best describes the cognitive changes typically seen in major depressive? Repetitive and intrusive thoughts, excessive dieting, flight of ideas, slow thinking, disorganized thinking, or exaggerated fear of being unable to care for self. And what do you think, Brittany?
Slowed thinking.
Okay.
Good job.
Yes, it says, good job. Yes, slow thinking says gummed mental gears. So patients with depression can have a slow demeanor. Their memory can be called at times patchy, and there may be selective disorientation along with lack of being able to concentrate. The patient may dwell on perceived faults and failures and be unable to focus on strengths and successes. Great job.
I can read the next one.
Okay.
Which of the following clinical findings best describes the physical changes typically seen in major depression? Fear of gaining weight, decreased libido, delusions, hypervigilance, euphoria, or excessive worrying?
The decreased libido.
Good job. A decrease in a patient's sex drive or libido occurs in some individuals. Several factors could influence a patient's libido, such as medication side effects, deficiency of neurotransmitters, or hormonal disturbances.
I can read the next one. So it says, which of the following clinical findings best describes the physical changes typically seen in major depression? Euphoria, paranoia, hypersexuality, energia, hyperorality, or delusions?
Energia.
Okay, so energia, the no energy bunny. Energy is defined by the ongoing lack of energy that patients feel with depression. Research has shown that 97% of patients with depression exhibit this condition.
Okay, I can read this one. Which of the following clinical findings best describe the mood changes typically seen in major depression? Avoidance of traumatic events, a sad affect, hyperorality, exaggerated fear of being unable to care for self, delusions, or paranoia.
Sad affect.
Patients typically have a sad affect while depressed. It has been hypothesized that due to the deficiency in the neurotransmitters norepinephrine, serotonin, and dopamine, that the brain does not function adequately, leading to the patient feeling unhappy.
I can read the next one. So it says, which of the following clinical findings best describes the mood changes typically seen in major depression? Disorganized thinking, fear or aversion, hypersexuality, worthlessness, visual hallucinations, or excessive dieting.
Worthlessness.
Okay, so worthlessness, so the empty pockets. Patients can experience the feelings of worthlessness and or hopelessness. Encouraging a patient to be self-efficient can help decrease these feelings.
I'll take the next one. Which of the following clinical findings best describes the mood changes typically seen in major depression? Hemi-neglect, exaggerated fear of being unable to care for self, fear or aversion, anger and irritability, anxiety, or hyperorality.
Anger and irritability.
Good. Patients that are depressed are unable to cope with stress and end up expressing their frustration as anger. Anger involves a sense of powerlessness over the situation.
I'll read the next one. So, which of the following clinical findings best describes the mood changes typically seen in major depression? Magical thinking, hypersexuality, hemi-neglect, anxiety, fear of impending doom, or guilt?
Guilt.
Good job. So patients can feel guilty about being depressed related to a loss or guilt for something in the past. Guilt can be a powerful emotion that can lead to a patient to self-doubt or even self-harm. Encourage the patient to talk about their feelings.
Okay, I'll read the next one. Which of the following clinical findings best describes the cognitive changes typically seen in major depression? Flight of ideas, fear of gaining weight, fear of aversion, ineffective problem solving, fear of impending doom, or hypervigilance?
Ineffective problem solving.
Okay, good job. Because of the lack of motivation and the decreased ability to manage stress, depressed patients find it hard to problem solve. Issues go unresolved, which can add to guilt or feelings of worthlessness.
And I'll read the next one. Which of the following clinical findings best describes the physical changes typically seen in major depression? Vegetative signs, excessive worrying, visual hallucinations, avoidance of traumatic events, euphoria, or normal appetite.
Vegetative signs.
And it says vegetative signs, vegetable with.
I'm so sorry.
It's okay. We'll just keep going. I'll read the last one. So which of the following, but yes, that was correct. So great job. Which of the following clinical findings best describes the physical changes typically seen in major depression? Self-neglect, hypersexuality, fear of aversion, hemi-neglect, repetitive and intrusive thoughts, or excessive worrying.
Self-neglect.
It says self-neglect, neglected appearance. Neglected behavior could be contributed to the individual having anergia. Individuals with depression show a lack of care towards oneself. Grooming and personal hygiene are usually not maintained. So overall, good job on this Picmonic. You did very well. 10 out of 10. So the last thing that we have is just a handout. And it's just going to, again, reiterate the information that we provided as far as what major depressive disorder is, some of the signs and symptoms, how it will be diagnosed, and just like the major treatments. Okay, so what is depression? As we discussed, depression is a mental state in which a person experiences extreme sadness, irritability, significant impact in their everyday functioning. They experience a depressed mood or loss of interest and pleasure in nearly all activities, and this needs to be for at least 2 weeks. So it could be daily, but up to 2 weeks. Risk factors. Some risk factors for major depressive disorder include being a female, as we discussed previously, prior episodes of depression, a family history of depressive disorder, lack of social support, if you have lack of coping abilities, the presence of life and environmental stressors, current substance use or abuse, or any sort of comorbidities. Signs and symptoms, as we discussed, that anergia, you're gonna have feelings of sadness, hopelessness, anhedonia, which is where you lack pleasure in the things that you might have, enjoy doing in life. Significant weight loss, and this is usually when you're not dieting. Insomnia, hypersomnia, psychomotor agitation. You also might feel very fatigued. Feelings of worthlessness, and this is daily. You have a diminished ability to concentrate. You're very indecisive when making decisions. And reoccurrent thoughts of death. This is known as suicidal ideations. And again, these signs and symptoms normally last for 2 weeks or more. Treatment options, as we discussed, SSRIs like Centraline, SNRIs, TACs, and MAOIs. Initial improvement, it may appear within 7 days, but sometimes with the SSRIs, it can take up to 3 weeks for you to start seeing relief of your symptoms. In some of these psychopharmacology medications, also you might see that your mood might worsen. So you might become, you might have more feelings of like worthlessness and the suicidal ideations, but that is normal. You should allow up to at least 2 to 3 weeks for those medications to begin working and you see a decrease in a relief of your symptoms. Psychotherapy, this helps to build one's self-esteem. So trying to reduce anxiety and understand, where your depression might stem from. It's going to help you with just coming up with triggers and things that might trigger your depression. Also, it helps patients deal with problems related to their depressive disorder. And then other options include cognitive behavioral therapy, so CBT. That's basically trying to like train your thoughts. So when you have certain thoughts about, depression or those suicidal ideations, what it's going to do is we're going to teach you how to basically remove those thoughts or to help yourself with those thoughts. So a common cognitive behavioral therapy is known as thought stopping. So when you start to have certain signs or symptoms or thoughts about, killing yourself or being worthless, things like that, we initiate that therapy to where you stop that thought and you think about other things. And then also interpersonal therapy, talking with other people that might share the same diagnosis that you have, that could be very helpful. And also interpersonal therapy just kind of helps you learn how to talk with people and also talk about your diagnosis. And so that's all we have for major depressive disorder.
I hope we were able to provide you with some information and resources regarding major depressive disorder to help you become more comfortable. Do you have any questions?
Actually, you guys definitely were a great help, and I think I have a much better understanding of my diagnosis, so thank you so much.
I'm glad to hear that. We'll send all the information that you've seen today, so I hope you have a great day, and thank you for listening.
Thank you so much, and I would hope the same for you all.
All right, you have a good one.
Thank you. Have a great day.
Thank you so much.